I have permission now. Thank you.
Mhm. Does anybody else need that permission? That would be
Devin Eskew with KPTV, please.
Devin? Okay.
Maggie Vespa with KGW. I also need that, please.
And Rebecca with OPB.
Man, it'd be nice if I could do this for everybody. All at
Kellee
once.
Azar from K2. Sorry.
All right. Let's see. I'm just gonna. You, Dave. Keeps shifting on me here. Did everybody get it that needs it now?
Sorry, Maggie Vespa with KGW. I still need permission,
Maggie.
please.
Says you have it. You want to check again?
I do not have it.
Maggie.
Rebecca Ellis here with OPB. I would also like it and don't yet have it.
Rebecca. If I remove it from Maggie and I'll add it back. Rebecca, did you get it?
Let's see. No, I did not.
I wonder if there's a limit.
If you're able to send the audio file after, that would be fine for, at least for me.
Yeah.
I'm okay. I'm good to go. I really appreciate it.
All right. Sorry about that. Again, I'm Deputy Chief Tim Matthews with Portland Fire and Rescue. I'm currently assigned to medical services and training. We want to welcome you on behalf of Chief Boone and CEO Eric Hunter for joining us for this press conference where we want to announce an innovative initiative that we're working on together with Care Oregon. At this point, I'm going to ask just a few housekeeping items. If you have a question at the end, just use your hand raise feature. I'm going to moderate, and it looks like everybody can unmute themselves as it comes up. But if not, let me know. I'll keep the chat open for additional questions. And I'm going to turn it over to Chief Boone for some opening remarks, and then we're going to go to Eric Hunter. Then we'll go back to Lisa Reslock for some program details, and then Q&A.
Great. Thank you, Chief Matthews. Good afternoon, everybody. My name is Sarah Boone, Fire Chief, Portland Fire and Rescue. And this is a really exciting day. And we're thrilled to announce the addition of our community health assess and treat teams to our Bureau, as well as to the city. Our agency has seen a dramatic increase in calls to 911 over the last 5 years because a portion of our community members are unsure how to access healthcare services and making 911 their only option. In an effort to respond to the needs of our community with appropriate services and resources, We have developed a specialized team that will engage community members in the upstream setting, connecting them to resources and primary healthcare services. And we believe our first interaction that we have within community in a person who is called 911 has the potential to change the trajectory of their overall health, truly getting them the right care at the right time. I want to thank Care Oregon for investing in this innovative model we are bringing to the city of Portland. Both of our agencies are committed to improving and protecting the health of Portlanders. Because as Care Oregon says, our communities are stronger when healthcare works for everyone. And so I will now turn it over to Mr. Hunter, Executive and CEO of Care Oregon.
Great. Thank you, Chief Boone. I appreciate it. And Chief Matthews and Lisa Reslock for the leadership you all have brought to this amazing effort, working with my team. You know, Care Oregon serves almost 400,000 people in the Oregon Health Plan in the Portland metro area these days, with a majority of those folks in the city of Portland. We believe that this program is really designed to be a proactive intervention, reaching community members in their time of need with one-on-one support from medical professionals. We know that this partnership with Portland Fire and Rescue, it's an opportunity to serve two purposes for us. First, to work upstream and help connect Oregon Health Plan members with in-the-moment care and health education so they can be better connected to the healthcare system and get the support they need when they need it and how they need it. Second, it's a way to support Portland Fire and Rescue in a program that's going to strengthen our entire community. Care Oregon's long recognized the link between strong overall communities and the health outcomes of the people in those communities. That serves us well, that serves our communities well, the Oregon Health Plan, and even taxpayers, because we're being better stewards of public funds serving these populations that need us so much. So we are so excited to engage with Portland Fire and Rescue on this. We believe it's a creative, innovative program that's really going to make a difference in people's lives. And we're looking forward to getting it off the ground and supporting it 100%.
Well, thank you, Mr. Hunter. My name is Lisa Reslock. I work in community health, Portland Fire and Rescue, and I'm going to dial in a little bit more to what really the assess and treat teams are. In 2012, there was a healthcare initiative by John Kitzhaber, and it really started talking about how can we transform the way healthcare is delivered in our state. And that's when you started to hear about the triple aim. And the triple aim is that our populations are better served, that healthcare expenditures go down, and that the quality of service is better for the population. And with that, healthcare transformation became something where it became a member first, a community member first initiative, where community members were being served. And as first responders, what we learned out of that initiative for the past 5 years is a lot of times community members, when they don't know how to access healthcare services, when they don't have access to a primary care physician, when they just don't understand the health system, they will call 911. And so this partnership, what it really is it's us partnering with a health system, Care Oregon in this instance, and saying, how can we really meet the needs of our population so they're, number one, better served and their health outcomes are improved, meaning they don't have to call 911. They know how to have better health. Especially with the COVID pandemic, we have a population that hasn't had their needs met. And we see that. We see that in the increased hospitalizations. We see that in our emergency rooms and being full. So this partnership, really what it's going to be doing, it's going to be sending 2 firefighter EMTs. We're going to be working in 2 different areas of the city. And those firefighter EMTs are going to respond to 911 calls. And we're going to stay on scene for a period of time where we address social determinants of health, where we address medical needs, and we really try to get them the care that they need on scene. A lot of times people don't necessarily need to go to an emergency room. They might need to be reconnected with their primary care physician. They might need a little wound care. On our teams, we're also going to have a critical care nurse that's going to be the oversight. So really it's a multidisciplinary team that's in the moment. Our teams with Portland Fire and Rescue, as well as Care Oregon's public health team, have really dialed in a program that we can use the resources that Care Oregon has in terms of their health resiliency specialists, their community health workers, and get people the care that they need in the time that they need it without having to leave their home if they don't need to, or address the needs on the street. I'm going to hand it over to Chief Matthews to speak more, and then we'll address some questions that you have. Thank you very much.
Thanks, Lisa. So just going to get into some specifics of what we're talking about here. In essence, with Care Oregon's assistance, we are going to position units or vehicles in the core area of the city, the downtown area, and the southeast portion of the city. These units will respond on low acuity calls, like Lisa talked about. And low acuity calls, from our definition, are sick individuals, abdominal stomach aches, minor falls, trauma, issues like that are traditionally are non-emergent in nature, but people are calling 911 these days because of it, just because they don't know any other way to access the healthcare system. Portland Fire, on average, responds to about 26,000 low acuity calls per year. So that's about 71 per day. And that's a 3-year average that I'm talking about here. These units, and this is a proof of concept, so we're going for a 9-month period here where we're hoping to expand this and go from 2 to 4 to additional units to cover the whole city as the proof of concept demonstrates that it's working as intended. And what we want to do is, as these 911 calls come in, we want to spend the time on scene to make that first touch really matter. We want to look at the person's living condition, look at really what do they have insurance, do they have a primary care physician. We know if a person's connected to a primary care physician, that they're likely to use that and make that contact instead of use 911. This gives us the opportunity to educate the individual about how to appropriately use 911 and how to access their individual health care and provide, really make them in control of how they're being navigating the healthcare system. And then Portland Fire is going to help. And this is all made possible with the grant funding from Care Oregon. So this is really no initial cost to the city as we're going through this proof of concept, which is what makes it innovative. Most cities are paying for this out of their general funds. This is innovative because it's a win-win. It's helping the citizens and all members of our community. It's helping the emergency departments who are getting overrun. It's helping our AMR partners and our fire stations who are responding to a lot of calls with a lot of extra resources that really aren't needed for low acuity calls. So we really view it as an opportunity to bring appropriate care to all members of Portland in a compassionate and caring way where we can spend the time with them. Our current model is a little bit different. Portland Fire is a first responder. We arrive on scene within 5 minutes and 20 seconds thereabout. We do an assessment, we provide immediate aid, and we turn over to AMR, who then is responsible for transporting to the hospital. And those are kind of our options. Under this model, we will respond with our community health assessment teams, and we will spend the time with the person to make sure their needs are getting met. We're not incentivized to transport. We want to spend the time there, however long that takes, to complete the social determinants of health, to figure out if they have insurance, to figure out if they have a primary care provider, and to really change their trajectory in the healthcare system. We think that will make a huge impact in the overall healthcare environment. And that's kind of one of the reasons we're really excited about this. We're anticipating last part of November 15th to the end of the year rollout on these units. There's some further details to work out because this is just now getting through council as of today. But we're going to be working hard on those to have those answers as far as specific call types, the operational times of day, etc. I'm going to turn it back to Lisa now to add anything else further to this before we go to Q&A. And again, if you have a question, Jeremiah Rigsby's on here too. He's been instrumental in this. All of us use your hand raise feature, and we'll try to get to everybody. Lisa?
Actually, I'm going to directly hand it off to Jeremiah. Jeremiah, do you have anything?
I think you all covered it well. We're really excited about this partnership. We know that this is a program that's going to impact the whole community. As Eric said at Care Oregon, we are very focused on the Oregon Health Plan population, Medicaid population. I think the innovative thing about the Oregon Health Plan in Oregon is how we're supposed to be focused on the community and adapting to the needs of the community. And this presents a really specific opportunity to use the data that we have at Care Oregon about our members and the work that Portland Fire and Rescue is doing to truly in an innovative way, figure out the best way to connect folks to the right care at the right time. And I think that was pretty well covered. So I think it's time maybe for questions, Lisa.
Okay, thanks, Jeremiah. So I'm scrolling through. I got about 3 pages here. If anybody has a question, just let me know now. Kellee?
Hi, yes, I have just a couple of questions. One's a clarifying one. I know that you can hear me, right?
Yes.
Okay, I apologize. So I just want to make sure if these are coming in as 911 calls, how are you guys being notified and directed? Is there like a certain criteria of what you can respond to?
Yeah, thanks for that. Yeah, there is, our BOAC, our dispatch center triages every 911 call that comes in. They have a system called ProQA that helps them with triaging incoming calls and categorizing them appropriately. We will be working with our medical director, Dr. Ju, in Multnomah County to identify the specific calls will be going on, the ones that fall into the low acuity range based on their triage as they're coming in through BOAC. And then those will be the ones that will be diverted basically to these chat responding units. Does that answer your question?
Does. Thank you. And then we've had a lot of talk about Portland Street Response also being on the ground there, specifically in Southeast Portland. What makes you guys different? And also, is your coverage area more broad?
Lisa?
I'll address that. Yeah. So Portland Street Response is a mental health and behavioral health crisis response. CHAT is what the acronym is, Community Health Assess and Treat. CHAT is really for physical chronic health issues. So I always explain it like this: is when you have, let's say, a postpartum depression problem, you're not going to go to a cardiologist, right? These chat teams are specifically to address the health needs of our population, the diabetes, COPD, any kind of health related issues. Portland Street Response is more of a crisis mental health and behavioral health houseless. So our teams will work together. Let's say chat responds to a call and someone's in mental health distress. We will call PSR potentially if we're in the same area. Right now, like Chief Matthews said, the initial proof of concept phase, there's going to be a vehicle, a chat team in the downtown region, and then there's going to be one in Southeast. So as this proof of concept is working, we'll be able to see when and where the teams can address each other and co-respond, not so much co-respond, but how they're going to work together. But they are two specifically distinct programs addressing specific, distinct problems that our population face. So hopefully that answers your question.
That is very helpful. Thank you. I appreciate it.
Okay, we have one question in chat regarding the staffing. The specific staffing model in this is still under some negotiations with our labor management, Local 43, our union there, and Portland Fire. Our intent is to use, an EMTB personnel up to a firefighter or specialist. There's a range there that during our proof of concept, we'll be working in partnership our firefighters already know how to respond in emergency vehicles, use radios, use MDTs, and work with our dispatch center and our local partners. So it's probably going to be a hybrid model, but again, that's all under negotiations with the local 43. And so that's that. There'll be more details on that coming out forward. As far as the cost, we're on a quarterly key performance indicator rollout during the proof of concept. We'll start with some upfront funding to get the personnel and logistics in place. And each quarter we'll report back and work in partnership with Care Oregon on continuous funding throughout the proof of concept. And then as we get towards April, May, we'll evaluate the effectiveness of the program and then work with Care Oregon on the future going into fiscal year 2022. Currently, the grant that's being provided by Care Oregon is funding the proof of concept phase of this. I don't see any other hands up right now. Maggie, you have a question?
Yeah, I do. Thank you so much. I have two questions. The first one is really brief. I know the times that these teams would be out and working in the communities, noon to 2 a.m. Is that 7 days a week?
Currently, our proof of concept, we're the noon time frame is we're looking at a swing shift, but that specific start and end time is a little bit of again, we want the data to drive that, so we're crunching some numbers with our data analytics to see what that's going to look like. The proof of concept initially is 40 hours a week, and so we'll probably be looking like at a Tuesday through Saturday swing shift type operation. There's nothing that prevents us from spooling up faster than that. It's really kind of just making sure we iron out all the details. There's some protocols we're going to follow on scene. We need to get those in place and then do a kind of a continuous quality improvement after each call and make sure we're doing things correctly as we're going through the first quarter of operations.
Gotcha. And just for a layman, a swing shift in your world, hours to hours means what?
We're probably looking at like 1400, which would be 2 p.m. to like 0200, which is be 2 a.m.
Gotcha. And then my second question was, I really appreciate it. My second question was, since this is obviously aimed at sort of addressing and reducing or eliminating the bottleneck of calls that come into the emergency pipeline that aren't necessarily emergencies, Portlanders will still access this by calling 911, correct? And there's a 911 responder shortage and a problem with wait times. So I'm wondering if just your concerns about that reality, and how that might make this more difficult to get these teams on the ground, and B, if there might be a different number that Portlanders are asked to call in the future to access this care.
I'll address that, Maggie. When we say a preventative model in upstream, what we're meaning is right now for this proof of concept, we want to address the community members' needs when they raise their hand that they need help. And the difference of this model is we want to educate them on how to use their own resources. So that's where the prevention comes in, is that right now our society and community, people call 911, like I said, because they don't have another option, but we want to show people their option. So for a while, people will call 911 until they realize that, oh my goodness, it's more beneficial for me to go see my doctor. I can make an appointment. I don't have to sit in an emergency room for 4 hours. So initially, of course, as we roll this out, it might take a little time, but the education aspect and really spending time with people on the front end is really what's going to transform our healthcare system. That's what we want to do. We don't want to just create a program with Care Oregon and other health systems. We want to really transform our health system. We want to have it so our community understands that there's so many resources available to them. And ultimately, we believe that that's going to drive down their ability to even desire to call 911. So as you said, initially, it might be a little bit of a bottleneck, but that bottleneck will be smoothed out by more units around the city, by us addressing these needs on the front side. So there is more allowance for transport and emergency calls. The emergency rooms won't have as many people. My other job is I work at Emmanuel Hospital as a nurse, so I'm very acquainted with the hospital system. And we believe by working all together with the health systems, with Multnomah County, with the hospital systems, we're really going to be able to create an environment that's going to be beneficial for the community members.
Thanks, Lisa. And also,
Thank you.
As 311 is created and ramped up, there is the potential that some of these calls could come in from that matter. So that's another issue we're going to be working with our dispatch center on that. Maggie, your hand's still up. Before I go back to Kellee, do you have any other questions?
Oh, I apologize. No, I'll bring that down. Thank
Kellee?
Hi, sorry, just another follow-up question. There has been some concern, and I understand that PSR is different, but safety, and I assume the same would be for you guys as well. I know you're responding mostly to medical calls, but are there any safety precautions that we can know about that your teams will be taking? Will they be wearing any sort of bulletproof vests? Will they have any sort of defense if something were to take a turn and wasn't as it seems?
Chief Boone?
I'll answer that. Thank you, Kellee. I want people to really understand where we are in this point in our history. And we have been tasked when it comes to meeting the needs of a population we serve. And right now, we're in a humanitarian disaster. The intent, whether it's Portland Street Response, is how do we create a new responder to meet the needs where our system, as it currently is, this legacy system, isn't serving everyone well. And so we know the gaps, especially when it comes to mental and behavioral health, especially when it comes to our most vulnerable population. Portland Fire and Rescue sits on the same platform that when somebody calls 911, we can send a responder. And we're just trying to find that most appropriate responder. And so a lot of people, when it comes to PSR, have vested their time, put in a lot of work. And we know that if we're on the front side and make that first contact, where you have trauma-informed de-escalation and experience when it comes to mental and behavioral health crisis, that there's going to be a better outcome. We also, as a licensed healthcare provider that sits in the pre-hospital setting, that is licensed under the Oregon Health Authority, this is a service we provide in addition to what is mandated by charter, which is fire protection and rescue into hazardous environments. And so this chat team, as well as in partnership with Care Oregon, is meeting the needs of a healthcare crisis where people either don't have access to care, they're on the verge of, maybe losing their housing. They have a lot of needs in the environment which they live where there just aren't the resources. And so we looked at a way of how do we meet the needs of community and really allow them to make the determination of their care. So we're bringing care to them, where PSR is like a more appropriate responder, but we're just trying to use our platform in a way that helps meet the demand of where we are. With that being said, make no mistake, when it comes to our emergency responders going into IDLH, which is immediately dangerous to life and health, those are our 4-person engines and trucks, whether it's, whatever the environment we can't control, we have to be able to provide levels of protection because that's the only variable we can control. So when it comes to PSR or when it comes to chat, that's going to be on the experience as far as being able to read a situation and making a decision in the moment. But as a fire agency and as a fire chief, my number one responsibilities is to ensure the health and well-being and the wellness and safety of a workforce. Whether it's multidisciplinary, whether it's PSR, whether it's chat, or whether it's our fire responders. So I will say when it comes to ballistic vests, it's no different than life jackets. If we have a fire or something, or a medical emergency on the docks or in the marinas, it's just a level of PPE that's available to any responder or any employee within Portland Fire. Does that answer the question?
Yes, it does, but I just want to clarify, and I respect the answer fully, and I really do appreciate you taking the time. So because chat is part of Portland Fire and Rescue, I'm assuming your answer is that yes, they will likely have those ballistic vests as well. Is that correct or incorrect?
So the option will be available.
Okay.
But I would say when you're trying to connect with community, and what we know when we go in and provide care, that's not what I hope anybody needs. That's not how you establish trust. That's not how you create an environment. But I do want to say there are times where you never can control what happens on scene. And so that is an assessment every single time. Mm-hmm. So they have that to fall back on.
Yeah. As a lifelong Portlander, I agree. I hope it's never needed as well. Mm-hmm. I appreciate the answer.
And Kellee, we have protocols in place for every call that we go on, and every call that chat will be going on. We have protocols in place that are specifically designed to protect our workers. So we don't just blindly go into situations. It's with a lot of thought and initiative that we have plans in place to address the issues that come up. So thank you for your question.
I appreciate the answer. Thank you so much.
Okay, just a quick pause here. Eric, Hunter, do you want to add anything to any of this at this point in this conversation before I go back to Maggie?
Well, I think to the questions asked about sort of what some of the value is, what's different. At Care Oregon, our mission is to inspire and partner to create quality and equity in individual and community health, right? So we see this as all of that. The community health aspect is huge. We talked about, impacts to the system, and we see almost a quarter of our members that access the emergency room didn't need to access the emergency room, right? And so when you think about the ability to intervene with those folks to get them the right care at the right time, that helps out with the resources at transportation and our overworked emergency rooms and keeps them from having to be in a situation where they're away from their family so much. And so I think that, we're excited about the opportunity to really change the dynamic of how people see the healthcare system and realize that the emergency room is not the first resort. It's necessary quite often, but it's not the first resort. So the education piece that Lisa spoke of will be an integral part to how we speak of this program and incorporate that into all the work we do with our members and our providers.
Thank you. Maggie?
Hi, yeah, this is a last one for me. It's just an incredibly baseline question, but just to have this in your own words, would maybe, Chief Matthews or Chief Boone or anybody who wants to jump in, just kind of give some examples from your experience or your crew's experience of the types of calls that we're talking about. Because I think to Kelly's question earlier, people might think Portland Street Response and maybe not quite, get the overlap of this need that exists and this sort of like category of calls that has been creating this bottleneck. So in your experience, what kinds of things have crews been sort of tied up responding to that this would take care of?
Yeah, a typical example of some of the calls we go on are just you're a person who's feeling ill. They are not feeling right. They're maybe wondering if they're sick or, they have, and basically it's a sick person call. That's one that ties up quite a bit of resources. And so that would give us the ability to go, we're looking at the potential to provide, the COVID-19 test, maybe the vaccine, maybe the flu vaccine. There's a few options there that we could help and assist. So a sick person call, abdominal stomachache, a minor trauma, a cut, We've had calls for itchy toes. There's just things like that that really don't require a 4-person response that we would look at: headaches, back pain, things that statistically don't result in a code 3 ambulance ride to the hospital. And we have very good data from Multnomah County and Care Oregon and our medical director on what type of calls those are. So they keep extensive statistics on call types and which ones ultimately could result in a code 3, which was lights and sirens to the hospital. And so the ones we're focusing on in this program are the ones that statistically don't result in that. The ones that are a code 1, no lights, no sirens, slow roll to the hospital. And then they're in and out of the hospital within 2 hours. So we know it really wasn't an emergent issue. But this is, we value our stakeholders and our partners in the healthcare setting. So we're going to really partner with Multnomah County and AMR to distinguish specifically those call types. And again, we'll release those, the first part of November once we've coordinated with our stakeholders on those specifics.
And a little bit more, some examples more specific. If you're a diabetic and you haven't taken your insulin, you ran out of your insulin. We have a Meds on Wheels program where we can pick up insulin, deliver it. When you have congestive heart failure, COPD, you have had some kind of surgery and you've been vomiting for 3 days. Questions and issues that really deal with the tri and comorbidities of the population are really what we're focusing in on.
Great. Thank you both so much.
Okay, I don't see any other comments or hands raised. Chief Boone or Mr. Hunter, do you want to add any final comments here?
You want to go, Mr. Hunter?
I just want to sort of just close by saying that we're really excited about this opportunity and the partnership we have with Portland Fire and Rescue. We appreciate the dedication and the vision of Chief Boone and her entire team, the support of the county, the city government, and Commissioner Hardesty's been in the mix on this, working with us. It's the right thing to do. It's the kind of thing that Care Oregon does in our sort of place in the community. And we're thrilled to be a part and hopefully set the example for future collaborations with public and private partnerships to just get things done. We know the needs are there for these populations and the community in general. So let's see what we can do to move the needle and get things done and not sort of chat about it anymore. And so I think that hopefully this is seen as an example of folks getting together and actually making it work. So we're thrilled.
Yeah, thank you, Mr. Hunter. And I'm just going to say, just a huge acknowledgement to the team from Care Oregon and Portland Fire's team when it comes to Lisa Reslock, Chief Matthews, Jeremiah Rigsby, and also under Commissioner Hardesty. And I want to thank the mayor and city council, because I think everybody recognizes, again, where we are today and where we started from. And this really is looking at legacy systems that no longer serve us well today. And so as people are looking at, increasing the staffing at BOA, as we're looking at automated systems to handle the volume, when we're looking at staffing shortages across the healthcare industry, as well as in the pre-hospital setting, when we look at a population in our community that doesn't even have their basic needs met when it comes to housing, when it comes to food insecurity, when it comes to health, we know where we sit is the health side. And we're doing everything that we can to create programs and partnership so we can bring a new responder and address those needs. This is all hands on deck. I do know that. And so as we look at bringing a face to the statistics of the bulk of calls people are talking about, it is bringing the right care to them and then being able to help them navigate when it comes to a healthcare system or when it comes to community-based organization, whatever their needs are, they are going to be part of the determination in how that care is applied. When you get to make that determination, it empowers you. And so when we look at a population, just because of the conditions in which they live, that doesn't mean that they don't have an understanding of what their needs are or what their most appropriate care is. And so we're just part of a wider network where our first touch, when we say is going to change the trajectory and build a new model, that bulk of the people that fall into the 911 system where it's not emergency, if we give them the right resources and tools, that we know that we can change those health outcomes and connect them to those services, that you're going to have a healthier city, a more thriving population. But we have to start today. And that's why this is so exciting, because Care Oregon is vested, the city is invested, and we have people that work day and night when it comes to serving 24/7 and providing care to our community. So thank you.
Thanks, Chief Boone. Thanks, Mr. Hunter, Jeremiah, Lisa. That's going to conclude this part of our press conference. It will be a press kit that will be released by our joint team here shortly. So if there's additional details, you can look there for video clips, and we'll try to put the audio in there for Rebecca Ellis on it also. Again, if you have any specific questions, reach out to one of the team here. We'll be happy to answer those for you specifically.